Welcome. My name is Peter Strong. I'm a professional psychotherapist specializing in online mindfulness therapy. So, a lot of people are looking for Skype therapy for anxiety and depression. Skype therapy is a very effective and very convenient way of getting the help that you need to overcome your anxiety or depression. I offer Skype therapy and have done so for over 10 years now, in which I specifically teach mindfulness therapy for help with anxiety and depression and also addictions and many of the common psychological problems that cause emotional suffering. So if you'd like to get started with Skype therapy with me, simply email me. Tell me more about yourself and what's happening for you emotionally, and I'll be happy to explain to you how we can work on reducing the level of emotional suffering that you're experiencing by using the methods of mindfulness therapy. I will teach you specifically how to apply mindfulness yourself for working with your emotions. This greatly increases the effectiveness of this approach. So we will work on your anxiety or depression during sessions using mindfulness, but you will be able to continue that work between sessions. This means that you will see results much quicker than in conventional talk therapy. We work at a very practical level, really learning how to work with our thoughts and with our emotions more effectively. We have to learn how to break free from that habit of becoming overwhelmed by reactive thinking or becoming a prisoner of our learned emotional reactions. Anxiety and depression are best thought of as being habits. They are learned habits. We acquire these habits and then we become a prisoner of them. So mindfulness therapy is a way of learning how to break free from these habits and how to neutralize them. So all habits thrive on unawareness. They operate unconsciously. And in mindfulness therapy, we employ more consciousness. We learn how to bring conscious awareness to these habits. And that's one of the first principles for breaking out of any kind of habit, is to make them more conscious, to bring consciousness to them. And the way we do that is by actually learning to meditate on our anxiety or depression or other emotions. This is a way of bringing that consciousness to them that will eventually break the habit. We learn to observe our reactive thoughts as well. Reactive thoughts effectively feed anxiety or depression, and when they are operating unconsciously, they provide a continuous source of fuel. So we need to see these patterns of reactive thinking very clearly, and we need to change our relationship to them so that they don't overwhelm us, that they don't take away our choice, that they don't control us. So we meditate on our thoughts. This way we become the observer of those thoughts, and being the observer stops us becoming identified with the thoughts. So that process of reactive identification is the main problem. It's the way that we simply become overwhelmed and identified with conditioned emotional reactions, and thoughts. So we learn to break free from that by developing more consciousness. That's the first training in mindfulness therapy. The second is learning to change the emotion itself, learning to heal that anxiety or depression. So healing is a very big part of mindfulness therapy. There are many aspects to the healing process, but the most important is developing this conscious and caring relationship that is so much a part of mindfulness training. With your emotions, we learn to develop compassion towards your anxiety or depression. We learn to develop compassion towards your emotional pain. This is an essential part of the healing process. The biggest problem for most people is that the anxiety or depression becomes isolated. They become disconnected from the emotional pain. And when that emotional pain is disconnected or abandoned or neglected, then it cannot heal. So that combination of disconnection with your emotions and reactive identification with your emotions is what really causes the emotional suffering to persist and prevents healing. So we develop this inner friendship and compassionate relationship with our emotions, and that is a vital part of healing. There are other things we will do during sessions, but those are two of the key components: overcoming the blind, unconscious habit of reactive identification and reconnecting with our emotions and developing a strong consciousness-based relationship based on compassion and mindfulness with our emotions. If you'd like to learn more about the mindfulness approach for healing anxiety and depression, please contact me. This approach is very effective, and people usually see quite big changes after the first few sessions with me. So if you'd like to get started, please send me an email, and then we can schedule a Skype therapy session at a time that works for you. I see people worldwide. It doesn't matter where you live. Most of my clients live in the USA, but I also see many clients in Europe and the UK and as far away as Australia. All you need is a good internet connection. So please contact me if you'd like to get started with Skype therapy for your anxiety or depression. Thank you.